So yes, I believe we've got 63 people here. So good morning, everybody. My name is Danny McKendry from Architecture and Design Scotland, and welcome to this event. It's how can the place, looking at outdoor space, place, health, welfare, and well-being at this time, and we'll try and look at it through the old lens of how we were looking before, but also through this lens of where we're at just now. I want to take an early opportunity to thank the sponsors here, NG Homes and Place Scotland, and our partners, A+DS, NHS Scotland, Health Scotland, and RIAS. And want to thank all the delegates who have signed up to this prior to the changes, and for their patience and finding a way to run this event. So thank you very much for all of that. Thank the speakers for the time. It's busy, difficult time just now, so I'm thanking you all in advance for coming along and helping us out today. I'm just reiterating as well, originally this was meant to be a full day event, and it's now been split into 2 sessions to allow our speakers to be spread out and accommodate them. And actually, because of the format we're using, it's probably easier to do it over that. So we'll forward invitations to the originally signed up delegates for that as well. Today we were due to have John Howie. Unfortunately, John has been unwell, and he's sent us an apologies, and we really do wish he makes full recovery and is back to health soon. Andy gave me a bit of a fun one to share with you, but apparently there's no fire drill today, so if there's something going on in your own house, sort it out yourself. We can't help you, but so thank you very much, everybody. I'm going to just say a few words in advance of other speakers. Our other speakers today, so a wide range, but I'll introduce everybody as they go along properly. But we've got Dr. Russell Jones from Public Health, from Centre of Population Health, the Glasgow Centre of Population Health. We've got Peter Beaverback from PADS, and we have also Marguerite Hunter-Blair, Chief Executive of Place Scotland, and Margaret Fraser, the Regeneration Manager from NG Homes. So a variety of different perspectives on our topic for today. First of all, I'm just going to say a little bit about places from an architecture and design point of view, and what it means to us, and I'm going to move our slides on. So I represent Architecture and Design Scotland. We're a public agency. We are Scotland's design champion. We aim to bring people together to create better places to live and be in. So a kind of focused approach to design. We believe in the power of design to improve people's lives, and we think it's really, really important to, this must be values, not designed for the sake of it. And we believe that good design costs less, it's more efficient, especially in difficult times. So that's something to have in the back of mind. We'll come back to that, I'm sure, today. As an organisation, our purpose is to promote the value of good architecture and sustainable design, and what that brings to everyone's lives. And we do that in 3 main ways that are interrelated. We promote good work. We promote new tools in terms of place design, such as place standard, etc., which is some of you may be aware of, and we'll touch upon that. We share learning, our own learning. We learn from the work we do. We share that with peers, and we're constantly reviewing the work that's done. So we are kind of taking a constantly refreshed view of what's working and not working. And more formally, certainly traditionally, we have been advisors on design, both big schemes, small schemes, locally, usually helping local authority, but also community groups to make better use of their public investments and work better with communities to provide better solutions. We also work with the private sector, helping them to have efficient solutions and liaise with the public sector and third sector as well. So that kind of virtual circle and virtuous circle is very, very important. Why do we do this? I mean, there are national outcomes that the government want to do across a wide range of things about the economy, welfare, equality, groups. A lot of that's done through big investments in terms of health, housing, etc. And there are a number of documents that have been used in the past which can inform all of this, designing streets, designing places, creating places, delivering better places in Scotland, which have all kind of set the tone over the last decade or so around what is good practice and what are good approaches. Our organisation is referenced in the Creating Places document, and it considers, place to be the environment that people live in, the people who inhabit these places, and the quality of life that comes from the interaction of people in their surroundings. The quality of life is really, really important. And I know the work that was done in the past by Dr. Harry Burns and the kind of well-publicised work around that is very, very strong around what people need to be involved in. So, and just a couple of slides moved on here. I'll move one back here. What we've learned over the past few years, we look at our work. Three main things are really, really important in terms of learning. Looking at place, the qualities of a place, looking at the processes to deliver those places, how we deliver places, and the quality of that built environment, the stuff that's in it, the parts that are involved in there, and we help people through working in collaboration, facilitating conversations, and providing examples. And we can look at this in different scales. We look at the scale of the place brief, deciding what actually you need to be in your briefing towards designers, briefing towards developers, and how to making sure that the stuff that you need and the stuff that you want is all included at the early stages, so that it isn't happening by chance, that it's in your thinking and in your procurement and in your ongoing maintenance of a place. So that's about place briefs, site briefs, but also in the planning and procurement of work. I mentioned place, parts and process, and I think it's very, very important when you think about this that we, whilst all these things are interrelated, to actually have a very, very clear picture about the types of places we want to have. What is the vision for that place, what is its role for a variety of different people, what are the constituent parts of it, what's the stuff that you need to have happening in there to make the thing work, and what are the proper processes to make that happen. And that will inform things around leadership, governance, briefing, procurement, learning, engagement, etc. These are very, very important things that hopefully we'll touch upon in our conversations later on. And I think there's a way of thinking about this that's quite useful as well, this idea of, a letter to your younger self, thinking about, if I want to create a good place, how did I get there? What did I do? What should I avoid? So that kind of idea of thinking about, what are your tasks and priorities and what's your learning, and that, and being constantly reminded of why you're doing a job and why you're investing in something, that it's clear that this is a people-centered approach. Touch upon this, many of you will be aware of a thing called the place principle, being promoted by government just now. It's essentially about getting your act together as agencies working together, groups, communities working together, departments of councils working together, and moving away from a state of, chickens mentality of disorder and confusion, and even beyond this idea of organised individual impact, but towards a more coordinated impact, and ideally a collective impact where people are working together, sharing budgets, avoiding duplication, sharing ideas and sharing vision, and working together in a truly collaborative way. There's very good evidence that delivers better places that work better for more people for a longer time, and actually are more efficient in terms of John Howie is going to touch more upon this today. Unfortunately, John's not available, but again, some of you may be familiar with the Place Standard tool. I reiterate that it's not about a benchmarking of standard type of place, but rather a standard set of questions which are very useful for professionals and communities to ask themselves around how does this existing place work, how might the future place work, in terms of transport, moving around, access to space, play, quality of housing, local economy, identity, belonging, and things like maintenance as well. It's a very, very useful sort of ready reckoner and conversation starter, which if you haven't been involved in or used, certainly take the opportunity to look at. Unfortunately, John won't cover that today, but hopefully maybe in our second session we might have more time around that. But it's worth a look as a scene setter. coming towards the end just now, some work that we've been involved in is, as well as around this idea of town centres and places as caring places, and this idea of a person-centred approach to design and placemaking. And we have used, particularly in the conversation around older people, personas. So I suppose they could be real people, but they could also be kind of created characters, looking at trying to see how the place works for them through their eyes, how it affects them, what's important for them. And key things that come out there are the importance of green infrastructure, transport and digital infrastructure, community infrastructures, which are really, really important at this time, as we've found in the COVID-19 thing, this idea of how places actually work and how people communicate and help each other, and also housing infrastructure. When we were down in Portobello very recently, we had a conversation with people about trying to find out how their place works, how the different green spaces and community facilities and natural facilities link together, how people used them, and what they considered their identity to be. And interestingly, you know, people had varying different identities of a place. I think this is really, really important when we're looking at our investments. You know, what areas of geography do people identify with? What's their place? What do they feel a sense of ownership and belonging and freedom to use? So I think that's important to think about. And coming to an end just now, one of the things that we asked people there to do was to map the things they cared about, the places that were important to them that they might link together. But interestingly, what came up was people said actually a calendar of a year and what happens in that place is sometimes as useful as a map or a plan. You know, what is the year in the life of that place like, to understand it. And I think that's really, really important when we're looking at people's access to places, but also their sense of worth and well-being and health, etc., across the time, across a year, which, you know, in Scotland the weather is very different across the year, so this is a really important thing to think about that. But interesting as well, and going back to this idea of personas, I think it's really, really important to think about a day in the life of that place from an individual persona. One of the interesting things in Portobello was that there had been a great new investment in a great school, primary school, but one of the mums there said that actually, rather than going along the promenade, talking to friends, meeting people to go to the old school, she now has to cross 2 dual carriageways to get to a wonderful new school. But the whole experience is much more stressful, then social interactions are less, and physically it's not as beautiful a place to bring such joy. So how that place works, how a new place might work, is really, really important to think about in terms of across the year, but also in terms of the lives of different persons. So I think this idea of, you know, this is complex, but not to be frightened of the complexity and embrace the complexity, because only then do we achieve quality results that can be sustained and are resilient. So that's been a bit of a long introduction for myself and rather rushed up. I apologise, but hopefully it sets the scene. It'll set the scene for my understanding of our following speakers, and I hope that you enjoy the rest of it. We are now going to move on to Dr. Russell Jones, as say, from Glasgow Centre of Population Health, looking at impacts of space on physical and mental health. And I always like listening to Russell's statistics, so I do hope he has some statistics. He's always very well versed, so thank you. So can we move on to Russell's slides, please?
Good morning, everyone. I'm Russell Jones, and I'm here to talk to you a bit about understanding the impact of place on health and well-being. And sorry, Danny, it's a general overview and not many stats in here, but hopefully you'll enjoy it anyway. I work for Glasgow Centre for Population Health, which is a research and development centre. We're a partnership between Glasgow City Council, NHS Greater Glasgow and Clyde, the University of Glasgow. We're funded by Scottish Government, and our remit is to develop new ways of thinking and working in order to improve health and reduce health inequalities. This slide's going to look a bit strange. When I created this in PowerPoint, I didn't realize it was going to go up as a PDF and it doesn't have the animations. But basically, there are 2 main models of health, both of which are important when considering the evidence. The first is the biomedical model of health, which is really a model of illness. And it's what generally comes to mind when people hear the word health. Exposure leads to infection, which can result in a variety of different outcomes. However, the WHO has stated that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So the other model of health is the social model, which addresses broader influences on health and well-being. It recognizes there's often a need for social change. Excuse me. This slide also looks a bit strange, but basically it is, ideally it would have shown a couple of diagrammatic illustrations of the social model of health. The underlying one, the one you can't really see, is the Dahlgren and Whitehead model, a very early one, but still relevant. And the one overlying it is by Barton and Grant. Both of them depict various influences on health and well-being. It's not just about your biology or your individual lifestyles. There's a lot more coming into play, and they interact with one another. So what this means is that health and well-being are complex, and they have a system of interacting influences, emphasizing the need to move beyond silo working in order to address them. Danny's already touched on this, but the working definition of place that for this particular presentation was one that was developed in Creating Places back in 2013, and it talks about the environment in which we live, the people that inhabit it, and the interaction between them that creates the quality of life. So moving on to the evidence. The evidence makes it clear that place has an impact on health and well-being, and that interventions to improve health will likely be constrained by environmental and socioeconomic contexts. Back in the, this is another slide that was to be animated, but back in the 19th century, both public health arose from efforts to address a variety of diseases, resulting in high rates of mortality. These were predominantly caused by contaminated water, air, and overcrowding. While the Western world has successfully dealt with these, it's still faced with a variety of conditions that are influenced by place. Before the arrival of COVID-19, someone once said that traffic will be to 21st century public health what sewage was to public health in the 19th century. And although there are few cars on the road right now, this will likely become an even greater issue, traffic that is, as we emerge from the lockdown due to the concern over using public transport. The direct impacts of place on health are predominantly based on studies using the biomedical model of health. They are traditionally associated with epidemiology, planning, and environmental health, and include things like air quality, climate, water quantity and quality, noise, and traffic-related injuries. The indirect impacts are generally based on the social model of health, and they tend to focus on how place influences the determinants of health, like perception, social connections, and physical activity, which in turn impacts on health and well-being. Some recent studies also explore the interaction between the physical and the social environment. Now, these next few slides were produced by the Sustainable Development Commission a few years back to accompany a report that they did or commissioned on health, place, and nature. And this slide just indicates the areas that are covered in the knowledge base and also within the presentation. You can still access this online, both the report as well as the slides. I'm going to run through these really quickly, but I'm just using them to illustrate some of the evidence. Regarding natural space, people with access to nearby nature are generally healthier than those without. And there is a greater effect for those living in deprived areas. They have more benefit from being close to nature and close to green space. Air pollution can create and exacerbate certain health conditions, and increasing walking and cycling can improve road safety. Just to note that all of these figures are dated a bit and aren't the most recent. Noise can impact both physical and mental health. And as we've seen recently, flooding has a serious impact on communities, and it's likely that we will experience more frequent adverse weather events in the near future. Physical activity can reduce the risk of developing certain health conditions because decreased stress, and can also improve mental health. Once again, to note, these percentages and costs aren't up to date. And although we can only do it virtually or at a distance right now, strong social networks improve health and well-being. The lack of equity to access to resources can influence the opportunities that are beneficial to health and well-being. Mixed-use design that is walkable and has access to green space and other resources can benefit our health and also our mental state. Now, if we take a preventative approach, we can address a lot of the influences of place on health and well-being. It can create a lot of beneficial aspects, and it can actually cost less in terms of infrastructure and societal costs. This next slide just basically summarizes the characteristics of a healthy, sustainable community. And just to run through them quickly, they include good local employment, a safe pedestrian, cycle, and public transport network, and a public realm that's dominated by pedestrians. It includes a rich and diverse natural environment. It includes lots of access to local facilities and resources, locally produced good wholesome food, a rich and diverse cultural heritage, vibrantly textured social networks, and informed, engaged, and empowered individuals. Now, I've always thought that slides, that pictures are useful in illustrating messages. So here are a few that show environments that are conducive to health. And on the other hand, some pictures that illustrate some of the environments that are not so conducive to health. So what's the relevance of all of this as we emerge from the lockdown into what is often called the new normal? Much of the evidence is still relevant, but what we need to do is consider how to adapt to the emerging situation. For example, we know that green space is good for health, but we may need to repurpose it in some instances, so it's more about connectivity to nature to deal with the social isolation that's probably going to continue for many months to come. I know, for instance, that a lot of golf courses are currently being used for walking. Could this continue? Existing inequalities have come to the fore and are likely to become even more pronounced in the future. And so equity needs to be a consideration in all that we do as we move forward. We need to consider how to reshape existing places and create new ones to address social distancing. And as Dr. Hans Henry Kluge said recently, any steps to transition towards a new normal must be guided by public health principles together with economic and societal considerations. And I think we can also throw equity and sustainability into the mix as well. This slide is probably difficult to read, and basically what I just did was pull together some useful resources. I'm assuming when I did this that Andy will distribute the slides to people, and so it's just some links to things. That's it from me. Thank you very much.
Thank you, Russell. Thank you. And can everybody hear Danny again? Yeah. Okay, good. So thank you very much. Very, very interesting. We'll take some general questions at the end of all of the presentations, and we will continue now with our next speaker, Petra, and Petra's slides should be coming up shortly. So Petra Bauerbach is the Chief Executive from PAS, and she'll be presenting a number of slides now. So thank you, Petra. You got your slides in front of you, yeah?
Yeah, can you hear me all right?
Yes, clearly, thank you.
Okay, this is all a little bit strange, and it's quite difficult to interact when you don't see people, and but I hope everybody can hear me all right. And what I'd like to talk about is planning for health and well-being. So just very quickly about the organization that I represent. We have about, we're very much a volunteer-led organization with about 400 volunteers, and we are both a charity as well as a social enterprise. And the reason we started to get together a group of planners to actually help members of the public to understand better how the planning system works and also how they can engage in the planning system. So there are 4 key aspects to our work. Free advice service, which is confidential, absolutely confidential. Then there's a skills training, which is very much around the planning system for community councils, for example, who have a statutory role in this, but also for elected members and community groups. The reason we're focusing very much on the sort of civil and civic engagement role is because planning is very much a political activity, and it takes place in the town halls and in the community councils. And we want members of the public to engage more proactively with their place. We're inclusive because we very much believe that everyone should be involved in decision-making process that affects them, whether it's young people, whether it's seldom heard groups that are not traditionally engaged in, such as gypsy travelers, or groups that are really sometimes too busy in their day job to actually engage in shaping their places. And we're supporting the establishment of local place plans, which is now under the new Planning Act 2019, mandatory to have local place plans to work with all of the communities to articulate their vision and to develop their space. It's very, very important that for a place to work well, people have to feel empowered. They have to feel ownership of what is their place. So that's what we're trying to do. And of course, it's not a new mantra in terms of Scotland has always was very leading in terms of the town planning approach on the connections, just like we're now seeing in the place principle coming forward again. We have Sir Patrick Geddes, a man from Ballater who was very much renowned across the world, from Japan, France, and Germany, but hardly known in his native Scotland. And he coined the phrase place, work, folk. So in order to have a good functioning place, you must involve the folk. And of course, the work is important in place too. So we need to reevaluate our experience of place. We're just currently writing a piece on that. The pandemic that's happening right now is obviously requires logistics, and it requires a new way of planning. We need to have rapid and radical change to our experience of place that we're now seeing. We're all experiencing many more birds. We're experiencing lots and lots more cleaner air. And I think there's a real impact, a positive impact on this experience right now that hopefully will linger and for much longer and maybe shape some of our new decision making. The impact, of course, on mental and physical health and well-being is very much has to be thought through. And of course, also those inequalities that Russell talked about earlier on health and other outcomes, the inequalities of equity and the inequalities of access to green space, that has to change. Our places have to cater for everyone, irrespective of income and status. We already talked about health and well-being place that was talked about by Danny earlier on, about the context here. I want to quickly talk a little bit about the Planning Scotland Act 2019, because to some extent that really will bring a much greater equity around the planning system. The purpose of planning, what we actually want, and the long-term public interest is vital here. It's not just about short gains, it's about the long-term public interest. National Planning Framework, there's a new format now, which will replace the local supplementary guidance, and is much more wide-ranging. addressing also the climate change emergency and the improving of health and well-being. Local development plans, I hope we are familiar with those. There will be new process, and we'll move to a longer time frame, 10 years. And of course, I talked earlier about the local place plans, which will be a new tier of community-led plans and taking into account national planning framework and local development plan. And I think this is really important, the bottom up and the statutory coming together. And then, of course, the development management will mapping out our health effects on nature and national development. So we're talking more and more about a joining up of agendas and a joining up of resourcing. Again, integrating health and planning. So we have the NHS Health Scotland, the National Health Board working to reduce health inequality and improve population health in Scotland. And Danny mentioned earlier on the place standard tool. The place standard tool is really a fascinating tool, and it's now going to be accredited by the World Health Organization. And what it is, it comes from Scotland. It is a tool that has been tried with A+DS, Scottish Government, and NHS Scotland coming together, working across that. For me, what is so exciting about that tool is its accessibility by the general public. It doesn't just talk about how good design functions well, green spaces, but it also talks about the feeling and how I feel about the place. And by starting off with the language of that feeling, we all have that. It becomes very human. We're leaving the language of professionalism and so on out of the door. We are talking about feelings. What do I feel makes my place feel good? So I think I'll leave it with that and hand over to the next speaker. Thank you.
Thank you very much, Petra. Excellent and informative as always, and very clear slides. Thank you very much for those. Again, we'll take some questions collectively at the end. Our next speaker was due, as I said, to be John Howie, who's going to talk more about the place standard, but we'll hopefully cover that in our next session. But our next speaker, I'm glad to have, is Marguerite Hunter-Blair, the Chief Executive of Place Scotland, and she's looking at early interventions for children's long-term mental health. So, Marguerite, over to you.
Okay, thank you very much. Equally terrifying because I haven't actually just worked out yet how I'm going to change my slides. So I'm not sure how to do this.
There's an arrow on the side.
Yeah, there's a small little arrow to the right of the slide, and if you touch that, that should move your slide on.
Do you want me to do it for you?
Oh, wait, I've just found it. I've got it. Sorry. Yeah, right. Yes, we're great. Thank you, everybody. Thanks. New technology. Okay, so yeah, I'm delighted to be here this morning, and I'm really sorry that John Howie is unwell, because I think I might have included some different information if I thought he wasn't going to speak about the place standard, and in particular the children and young people's version of the place standard, which hopefully will be launched at some stage later this year. But just to make a start then, I think Russell touched on this already, that there is an enormous benefit to children's and everybody, not just children and young people, but everyone's mental health and well-being by being outside. And we see that just now in this lockdown time when the police are struggling most, not with shopping queues or people on the road, but they're actually struggling to try and keep people inside. People want outside to connect with nature and to take exercise. So there's a massive benefit, financial benefit, to people getting outside. And part of what we are trying to cultivate in Place Scotland is for children to have this love of being outdoors for their mental health and well-being. And we've actually got quite a struggle, despite even on top of what's happening in 2020, we're in a particularly good place. I often talk at this time in a presentation, I ask people to reflect on their play memories when they were 8, 9 or 10 years old. And I talk about the time when I launched a play programme in East Ayrshire back in 2008. And I had 2 packs of Cub Scouts aged 8, 9 and 10. And their favourite play memory, except for one boy, was indoors, supervised, and exactly where the parents thought they would be. And when we spoke to all the adults in the room, their favourite place to play was outdoors, in fields, barns, sheds. Some of them at the viaduct, and some of them had made it down to Ayrshore, about 8 miles away. When we asked the boys at Cub Scouts, look what you've missed out on, look what you've been cheated of, are you not outraged? They said, oh no, we'd be too feared. So those fearties are 20 this year. And they are our new planners, designers, parents and teachers, and people that we hope will go outside and appreciate the value of being outdoors. But if they were too scared to play out unsupervised when they were young, we do have a bit of a challenge on top. And the other anecdote that I use, it's actually a piece of research from Sheffield, talks about the right to roam disappearing in the space of 4 generations. And this was a study carried out in Sheffield, which illustrated how the great-grandfather Tom, at the age of 8, was allowed to go 6 miles to go fishing, and his great-grandson George is allowed to go to the end of his road to play, but in actual fact he doesn't really go beyond the garden gate because his friends aren't allowed out beyond the garden gate. And Tom is 21 this year. So these are our massive changes in terms of how our next generation is going to respond. And now on top of this fearfulness and anxiety that's caused through lockdown, where the simplification of the message is, if you go outside, you might die, I think we're going to have a huge challenge on our hands. So the good news part of the story is, in Scotland, we have a fantastic toolbox that we are going to have to put to good use now to try and alleviate a lot of the mental health that is going to flow out from what was happening already and what is currently happening now. So we know that play builds resilience, and we know that there is a very strong link between restrictions on children accessing unsupervised play and the current levels of rising stress and mental health problems. And again, I'm saying this is before the current situation. I can only imagine that it has completely exacerbated. Now, back in 2013, we had the United Nations General Comment on Article 31, Comment 17, which talks about the ambition that governments should have in terms of children's optimal health and well-being. And this is something I want to come back to. I don't think what we are about is anything that's just being good enough. In Scotland, we've moved beyond good enough, and we are aspiring to children and young people, and in fact the whole adult population's optimal health and well-being. And nothing less than that is actually good enough, and we must never settle for anything less than this. And they talked about a priority on the creation of a range of environments. We're not just talking about we need a few more playgrounds, or we need a few more green spaces. We need to completely rethink our places and spaces in our public realm and the priority of who gets access to those. And that's been touched on by Petra, by Danny, and by Russell as well, is the inequity in terms of who accesses what spaces. We have our National Play Strategy, and at the heart of the National Play Strategy, we have the principles of inclusion and sufficiency. So the play sufficiency duty that I'm going on to talk about from the new Planning Act that Petra mentioned is already embedded in our play strategy from 2013. And also embedded in that is the link between the need for risk and challenging and adventurous activities that will allow to build resilience in children that carries on into their adult life. Tim Gill has written on this in many ways. He's a great blogger and definitely someone worth following on social media at this time as well. Has done a few really good pieces about the current situation and children's need for play. And talks about this building of character and personality and the building of self-reliance and resilience that happens. And just a wee plug for our Play Scotland today, we have a new video coming out, short pieces of video on social media today with Catherine Solly, talking about the importance of building resilience in children, particularly at this time, through play. In Scotland, again, the regulators are very much on board now with the need to balance the benefits of everyday challenges and adventures against the potential risks. So our Care Inspectorate and our Health and Safety Executive are actually very proactive now and recognising that the days of wrapping children in cotton wool are over, and that is just no good for them, and it's no good for society, and it's no good for the future workforce. So another thing I like to talk about when I'm presenting about this, just to give a bit of context, is the fact that we don't have space standards for children. In Europe, we have space standards for chickens and cows. We can't have battery reared chickens anymore, but we still don't have space standards for children. And we do welcome the new Planning Act and a lot of what is happening in that. But the fact is that we need to have a focus on free range children who need sufficient and accessible informal play and recreation spaces. We're not just talking about fenced off playgrounds here. We're talking about more street play. We're talking about children having a higher priority in the public realm. I would include in that the elderly as well. And that children need to have space, time and permission to play in and around where they live. And it's also important to put in here that you cannot be a vet in the UK if you have not studied the modules as to why young adults need to play to fully develop. But you can still be a teacher in Scotland, and that module of why play, which is essential for children's development, that module is actually still an optional module. So we still have work to do on that. So we know that children play to survive and thrive, and this has a huge impact on their mental health and their physical literacy. And there was research done last year by Dublin University, which was across Ireland, so the north of Ireland as well as the south of Ireland. And it was very alarming to suggest that these fundamental movement skills that children have usually developed by the age of 8 in terms of running, kicking, jumping, skipping, and ball skills, what they're saying is by the age of 10, a quarter of children across the whole of Ireland haven't been able to work out how to kick a ball properly, throw a ball and catch a ball and run. So this is a current issue for us all. It's not just Scotland, but I suspect there's quite a strong read across from this research into Scotland as well. And we know that a lot of the children are starting primary school in Scotland overweight and obese. So we know that we did a review of all the research last year for the UK Children's Play Policy Forum. And it was very simple: play builds self-belief, friendship, resilience, happy, healthy children. Everything you need to build good mental health, really. And we are, what I said earlier, we want to aim high. We just don't want in Scotland to be good enough. We want the optimal, we want the best for everybody. And there's just some examples there. Ernest Shackleton, one of the greatest explorers and leaders across the world, really, ever, went off to sea at 16. Danny McCaskill, his ambition to ride the Coolin Ridge started age 4. And this is Rosie from North Ayrshire, who was the unclubbable child who hung about and waited till everybody had left the skateboard park. And when the lights came on at night, the security lights, she went in and practiced. And she made it to the World Championships in America. So this aiming high in Scotland, I think, is incredibly important. And just before I start the next session, where I want to talk about the new Planning Act and the tools that we have in it, I just want to say play builds community. And as was alluded to earlier by Petra and others, play is a social justice issue. And it is a spatial justice issue as well. There is no equity of access to space in Scotland, despite the right to roam and other progressive policies. Play is a spatial justice issue. So the play sufficiency duty that is in the new Planning Act is a place-based tool. I see it as that in this toolbox that we have for good mental health and well-being in Scotland. So there's no easy solution to tackling anxiety and mental health and well-being. We need a range of tools and levers and practitioners at different levels, but I think this is a particularly good one because it will help us tackle the spatial injustice that we have in Scotland in terms of children accessing the public realm, the open spaces and places that they need to play in, whether that's outside their front door, whether it's in their cul-de-sac. Sorry, I've just lost my presentation. I'll just try and get it back again. Well, that's it there. Whether it's in a cul-de-sac, whether it's in a green space where people walk their dogs, and these informal places and spaces which are incredibly important, as well as destination parks and playgrounds. So the two parts of this that I'm particularly interested in at the moment are the place efficiency assessments that will be carried out as part of the place efficiency duty. And something else that we managed to get into the Planning Act is a duty on children and young people being able to be consulted by local authorities on the local place plans that Petra was talking about. The point I'm trying to make here is that children need a balanced diet of play, and they need to have access to all the places and spaces around us and not just be confined to what a lot of us call KSC playgrounds, where you've got a kit fence and a carpet. Children need to be able to access all parts of the public realm. And we see that now. Earlier, someone was talking about people walking on golf courses. Children should be able to play everywhere. They should be the priority that we have, as should our elderly. And one of the challenges within this new place efficiency duty will be, how can we measure what we want to achieve? What is the ambition? How high can we make that ambition? What is the optimal best that we can achieve? And how can we measure that? And there is work going on now on the guidance and secondary legislation. But what Play Scotland is currently working on with a number of local authorities, almost half the local authorities, is already looking at the place efficiency or play friendliness of areas. What are the opportunities? What are the satisfaction levels? How accessible are they? And what is the quality of the formal and informal places and spaces to play? What involvement do children, parents and carers have and communities in accessing that and in planning it? What are the attitudes to children in the public realm? And quite often we know they're incredibly negative. Do we have enough adventurous places and spaces for children to play? Not fenced in, not hemmed in, and with some ambition that children can actually develop their skills of physical literacy that I spoke about earlier. And most importantly of all, what we need is this multi-agency and multidisciplinary approach. No one of us can solve this by ourselves. Looking at the examples set in Wales, who've had a place efficiency duty for many years now, what they've learned is it's about incorporating play at every opportunity. You can have 2 upstand curbs. If they're 5.5 metres apart, you've got a call for Kirby. You can plant 2 trees, regulation, goalpost distance, and you've got Wembley Stadium. So it's not difficult, and what we're not asking for is lots and lots of money to be spent. We just want to use the assets that we've got better. The other thing we really need to be very careful about is when we're planning for play, is planning to include everyone, particularly in the public realm. So these environments which allow children and young people to socialise, explore, play and exercise, which is really good to their health and wellbeing outcomes, are extremely good for the older generation, in actual fact for all of us. And as Gilles Penalosa says, if a place is an 8-year-old and an 80-year-old, then it's good for everybody. And we know that we have to pay particular attention to children. I know Peter talked about there about gypsy family communities. We need to think about children and adults with lots of different additional needs. And we know that from the research in Sweden that the lifespan for children with additional needs can be up to 15 years. So we need to think about this when we are designing our environments. Play Scotland has a good publication, a guide to creating inclusive public play spaces on our website. But what we do in our work with local authorities is what we really try to do is animate not just the usual suspects that we need to have on board, but more importantly, the unusual suspects from housing, planning, architecture, roads, parks. The people in charge of 20's plenty are sometimes our biggest allies. The people who can allow us to have a double wood pavement in a development are the people that we really need to engage with. And our vision is about giving children time, space and permission to play in and around where they live. I'm not saying we don't need the destination parks and playgrounds and green spaces, but on a daily basis, we just need to look at what we've got around us. And there's lots of streets and spaces that we could be making better use of for children's play. So the place principle that Petra and Danny spoke about earlier on are incredibly important, I think. And it's being used now by funders like Cora Foundation for the Children and Young People's Families Fund. A lot of us had to address the place principle and be able to say how we were using it in our work with children and young people. And what's really important about this is that place is where children are. Place is the heart of our communities. And if we can get the design of place and space right, much better communities. And it could actually save a lot of local authorities lots of money. So it's just about doing what we do, what we have, using it better and smarter with a different perspective. And children, young people and the elderly, I would suggest, at the heart of that. So what John Hybe was going to speak about a wee bit was the development of place standard tools for children and young people and other tools that are in development around the core standard, the core place standard tool. So Place Scotland and A Place in Childhood have delivered these tools for children and young people to the Scottish Government. At the moment, the core tool is also being redeveloped alongside another few tools to go with it. And I think there's going to be a fantastic new website, All Singing, All Dancing, with lots of guidance and good case studies. And these tools will all be in place by the end of this year, which is going to be really valuable. The timing could not be better, I would suggest. And some of the suggested uses for the children's version of the Place tools we were suggesting at Place Scotland is, we think there could be a starting point for co-designed safe routes to school or active travel. It could be a springboard for discussion about community and different viewpoints of different people. A live opportunity for rights-based discussion. Because remember, the United Nations Convention on the Rights of the Child, the UNCRC, is being brought into Scots law this year. So the child's right, Article 15, the child's right to hang about, young people to hang about on street corners, child's right to play, Article 31, are being brought into Scots law this year. And so all local authorities are going to have to really tackle and get their heads around how they can demonstrate that they are delivering on children's rights across the whole plethora they've got of policies and practice and provision. And we also think that these will provide a good point for children and young people to respond to local or national consultations so that their voices don't just get heard, they get acted upon. I have two a wee bit boring slides here, but I put them in just for people who are interested in this and might be doing research in this area. So this is the current policy context for play and the kind of where play fits within the policies that are currently involved at the moment. And in there, as you see, I talk about UNCRC into Scots law. And the next one are the policy drivers. This reducing poverty, closing the attainment gaps, improving health and wellbeing, mental health task force, and the new Public Health Scotland organisation, and their commitment to vibrant, healthy, safe places and communities. So all of these things can combine together to make it a very good starting point for Scotland, because really what we're trying to do is tackle spatial injustice and social injustice. And we can never deliver equity if we do not have successful strategies in terms of place-based strategies to tackle these. So just to conclude, the Gateshead Millennium Cohort Study in 2017 told us that by the age of 7, children spend half the day sitting. I feel I'm doing that myself at the moment on Zoom calls and various other things. And by age 15, 3/4 of the day. So this is where we are actually training children to sit down from the minute they start school. So these are things we need to completely fundamentally alter our thinking about. And David Attenborough talked about no one will protect what they don't care about, and no one will care about what they have never experienced. And he was talking about the environment, which I think is really important. But I also want to say that I think it's a very good analogy for mental health. So just to go back to that slide, good mental health starts with children playing together, being sociable and being outdoors. At the moment, there's a big restriction for indoor play in and around the home, and we are providing lots of resources for that. But to try and tackle the big mental health issues that we've got, that we will be getting created as we speak at the moment, because of the current situation, we need to think about how we're moving forward. And place-based strategies is the solution. And for those of you who have never seen these particular slides of mine before, the game the children are playing, I'm sure it's obvious, is the Timothy advert, Scotland style. Thank you very much.
Thank you very much, Marguerite. Fantastic photographs there. I may try that with my own children later today. I say I may, but we'll see how the Timothy goes. So wonderful stuff, very interesting, quite some worrying statistics of things that crept in on us. I suppose the rapidness of the COVID thing that's come in with us as well has meant very rapid changes in behaviours recently as well. So I wonder if positive change can be more rapid than the kind of negative things that have come in over, you mentioned 4 generations, but we may come back to that. So thank you very much. Our next speaker, one of our sponsors, is Margaret Fraser, Regeneration Manager at NG Homes, who normally hosts us up at Tarson House. We hope we'll go back up there some other time in the future, I'm sure. Margaret has a wealth of great stories about the people she works with in North Glasgow. So creating a healthier, wealthy, more attractive place during a crisis. So Margaret, over to you.
Okay, can everyone hear me all right? Can everyone hear me all right there?
Thank you, yeah.
Yeah, okay. Thanks for inviting me along. Thank you. And thanks to the previous speakers. That was really interesting. And I was listening a lot as well to what you were saying, Marguerite. I've previously carried out a lot of work around kind of play in a previous job, and it's something I'm keen to look at how we as an association can link into that. As you say, housing's got a big part to play in that. So I'm just going to cover just some of the slides today, just around the role of partnerships, as I say, to create a better physical, mental, economic well-being during a crisis. I'm just going to start with, is that working now? Just the next slide. So I'm just trying to...
Hi there. So we seem to have lost Margaret from our internet connection. That's the information I'm receiving here. Until she comes back on again, perhaps we could, I'm seeing something come out just now. We'll just take a little time out just now to get this sorted out again. If you have some patience with us, apologies for that. Whilst our organiser Andy is trying to reconnect with Margaret, I think, just take initiative and just go through a couple of questions that I may have, and we can start then picking up some questions that are coming through as well from our other participants who have joined in. And maybe we'll collate that with the questions towards the end. But in terms of this idea of social justice and injustice and spatial justice, in some ways, the time we're having just now, where people, I'm finding certainly anecdotally, are accessing spaces that they perhaps haven't accessed since they were maybe children. I see people out walking in my own community who I know don't normally walk. They normally be quite car bound. They tend to go to go to places to entertain their children. But what I'm finding, especially in this good weather, is the feedback from people is that they're enjoying doing things that they haven't done from the childhood, and that their own memories of play memories still are there. And when reignited, I have the opportunity to reignite. I've given them that kind of idea of they're trying things they haven't done for a while. I wonder if we can bring people back, having had this largely positive experience, albeit with the kind of concerns out there. But I don't know what people's thought is. Marguerite, perhaps are you hearing anything back from people around that?
Yes, I think the problem is that there's a lot of competition between the different spaces and how it's used. But I think what we're trying to encourage at our end is that children at least get out for a walk every day. And what we're working on a campaign with some other organisations to try and have the cars banned from some streets, because I think the problem is not much traffic, but when the traffic's there, it's faster. And what we're saying, if the traffic was banned on residential streets for part of the day, or the delivery drive very slowly or whatever, then we could probably have some social distancing play going on in the streets. Because the issue is physical distancing, and I think the problem is the outcome is social distancing, but it's physical distancing is what the government is trying to achieve, and social distancing is actually what's happening, and that's what's having, I think, a lot of the toll on the mental health of the children and young people. So I think we should be saying that yes, spaces that possibly would normally be closed should be opened up, like golf courses, but I think children really want to be able to just get out and play in their street. And I just think if we could get some guidance from the government as to how that could be done acceptably, then we could all start to push for that to happen.
Interestingly, I mean, anecdotally, my own children, I'm getting feedback here. Maybe. So my own children are, they're really missing their friends. We're getting them out a lot, and they're getting a lot of exercise. They're getting to play with each other, but it's a real thing. They crave the play and creative play of other children and their peers, and it's a thing sometimes we perhaps undervalue. It's a thing I'm aware of. Just, you know, we're trying to kind of have that mix of virtual contact with their friends so they can see their faces and have their childlike conversations, but also have that physical thing. So the physical thing is not just a physical thing, it's as you say, it's a real social interaction as well. Peter, sorry, you're wanting to come in.
Yeah, I'm just wondering, I mean, we tried a few years ago to roll out the idea of Kinderstraße, play streets, as they have in Holland and in Germany and elsewhere on the continent. And for some reason, it was trialed, and there are some areas, but it was never really as successfully introduced as a new way of engaging and actually putting the hierarchy of young people walking as number one in that particular road, in that particular street, and the car being demoted down to the level of, you know, basically don't come in here, or if you do it at a pace. And I see that a lot in still rolled out across the continent, and I don't know why we haven't done more of that. I also feel that a lot of the place is very segmented. So we have children over here, we put them in a little thing, in a box. We have all the people over there, and we put them in a little box, economic active. Various segmentation exists, and it's almost like we're no longer seeing that we're all part of a society. What really is so fascinating for me at this moment in time, and I'm being very positive here, is the amount of young children, aged 4, 5, 6, cycling on the road. I find that an incredible, lovely thing to see and to do, and I'm hoping we'll never get back not seeing that.
Okay, very good. I now see we've got Margaret returning to us, so I'm...
right, let's... okay, let's just see if we can... Margaret. Yeah, can you hear me all right?
Lovely, thank you.
Yeah, okay, let's see if it works this time. Yes. Okay, sorry about that, I don't know what happened. Thanks, Jane, for welcome back, hope I stay. So just a wee bit about NG Homes. I'm just going to kind of carry on into what we do. So just to put a wee bit to it. So many of you may already know, but for those who are maybe new to the area, so we're very much a community controlled housing association. So that means, that we have a number of board members who are local tenants, residents, and we are just in the process just now of establishing an NG Homes youth board. and in fact I'm putting out a brief for consultants to help to work with those young people, and I know that some of them have already been very involved in the whole thing around space play. In fact, one of them set up a MySpace over at Springburn Park, so that's something I think for the very, very near future. I had a Zoom meeting with him on Saturday, and I want to really move that on during this period when we're in lockdown. So we're an anchor organisation, as people say, because we've been here over 40 years. We're a consistent, organisation area. We've got something like 7,000 properties, so that's a mix of 4,500 social rented properties and owners there as well. We have a social enterprise, NG2, which kind of manages the estate management, etc. You know, a lot of the environmental works that we're doing, and that's actually built up quite considerably over the time. So I oversee the management of a community regeneration department. My background is in community development, housing, and in areas such as social justice. So I'm pleased that I'm able to do that within an organisation like NG Homes. We also are host organisations for Thriving Places for Uckhill and Postle Park, and we're in the process, we're also host for the Business Improvement District in partnership with Scotland's Towns Partnerships, and that's for the Postle Park area, and I'll tell you a wee bit more about that because it's come particularly relevant within this crisis. And also we're host for the Link Up, which is through Inspiring Scotland. We have been there for a number of years. We've got high levels of community engagement, capacity building right across a range of activities, right across age groups, across cultures. So, you know, this has been in terms of what's happening just now, it's been key for us to maintain contact with those people and, in fact, work with those people as far as some of the solutions. And what we do have very strong cross-sectoral partnerships, but can I go on to just a wee bit later? Try and get back onto here. As Andy mentioned earlier, I mean, we firmly, and I certainly firmly, adhere to the words of Sir Harry Burns in terms of, think about the unrecognised capacities in every community, find them and provide opportunities for people to offer them. And relations do build a community, and we need to build them and utilise them and put citizens at the centre and engage with them as actors, not recipients. I have to say that during the past 5 weeks and just previous to that, that's been absolutely key to the, what's happening in north of Glasgow, people really coming together. And it's just been absolutely tremendous, the fact that the local people are collectively approaching things around the kind of whole area around food support, support with medication, constant contact with people by telephone, providing activities for young people, and really kind of coming together. And very, very real examples of that. One of those being the Baby Food Bank, which had established a few months earlier and has now been absolutely vital to help families, because once you provide them initially with, maybe what they need, then you're opening up the doors and to talk to them further and keep that communication going. People very clearly at the centre of what's happening here in the community response. We've always, kind of looked at ways that we can continue to get to know our tenants. We've built up the organisation as, through a series of stock transfers. The largest stock transfer being about 8 years ago, bringing 2,500 new tenants to our portfolio. So you can imagine, that we had to really do quite a lot of work in getting to know who our tenants are. Of course, we have got the details in terms of the demographics, etc. But what really do our tenants need, and what are the issues that really affect them? So we have been carrying out, through our stock condition survey, we've been carrying out also a social survey and we've been looking to really kind of build on that. So find out just in terms of people, income levels, also health, anxiety levels, varies. And we've got some details in terms of a short study of that, and we're going to pull that together as we progress. But we do know, obviously, that the groups that we're working with are older age groups, families, lone households, ethnic groups, those with disabilities, and some of the issues that we're coming across, it wouldn't be a surprise to anyone. Oops. It wouldn't be a surprise to anyone, but issues around finance, isolation, mental, physical health, social issues, and environment, all very key and all very much, as we can see, within the place standards. So we're, as an organisation, we take responsibility to our tenants and the wider environs very, very seriously. And we work closely in partnership with others to do that. We look to bring people together. So we do that using our existing resources and strong partnerships, providing access to safe, welcoming community spaces, and working with people to ensure that, that we can build on that. We carry out a variety of inclusive fun activities, intergenerational, intercultural. Moving forward, we'll talk about how that's going to look later. Conversation events. So we've held a number of conversation events around ageing population, loneliness, community, mental health. We'd one around feeding our community. So, and we've brought all of that together. Moving on from this, I would suggest that we will then start to work with people on a variety of conversation events in a variety of ways to look at the impacts of the COVID crisis on individuals across our community, because they live different areas, different types of properties. It could be multi-storey flats. We've got 14 multi-storey flats. We've got deck access. We've got back front doors. We're just ready to start a new build. So people have different experiences depending on where they will live, and we really need to capture those experiences. What we've always done is look to develop the themes, just using a community development approach, bring that back to the community, and then create an action plan on those themes. And some of those have been kind of relevant in how we're actually working around this crisis. Go on to the next one. COVID crisis. Oh no, fresh page. You got me now. So these two images were actually drawn by one of my staff members, Michael. He's a housing integration officer, deals a lot with the Chinese community, but also with our other communities. And he's, as you can see, a fantastic caricaturist. So he's been, kind of providing these, and that's something we're also working on with the children around programmes using cartoons, caricatures. So we felt it was relevant. But you're seeing there, the coronavirus, the way it's working just now, and the social distancing, which is going to be very much relevant in how we continue to work around the community. Yeah. So some of the impacts that we've seen, and I've just really, we've been extremely busy over the past 5 weeks and responding to this and with other partners and trying to operate a strategic approach as well as a very local get right into the community and deal with it. So I've just kind of had limited time, so apologies for that, but just in terms of what we're seeing just now and the impacts, very much the food crisis. So the immediate need, and when you look at Maslow's hierarchy of need, what is it we need most? So it's our food, it's our shelter, and it's our food, etc. to make sure that's going. But as we're moving on, it's also been about nourishing food as well, and how we're delivering that food, how we're maintaining, the health and safety aspects, but how we're also kind of doing that. I will go on to that later. We are seeing already through our regular telephone calls, and we have a number of staff furloughed, but we also have a number of staff working from home, and we have other staff directly in the area. For example, our 24-hour concierge service are operating in shift systems. We're constantly, all of us, on the phone and with other members of and other volunteers from community organisations, and we are seeing that there is a sense of loneliness and anxiety. Increasing anxiety, and just having that telephone call and having somebody, just another end of that phone is really what's making a difference, and we're able to kind of, so we want to kind of continue that, because for some people, they don't have any family, or they don't have the access to the family. We've also had family members maybe living a space away, you know, and can't get down to their elderly father or mother. So they're, you know, grateful that there's someone in there. There's organisations, there's volunteers out there that are helping with this. The closure of schools has been a big area. I mentioned to someone earlier on that although some children got materials through, classroom materials through, but some of that was also to be accessed using technology. But for a number of people, they don't have access to tablets or to laptops, etc. So what we've done is we're working with an organisation on reconditioned laptops and tablets, so that we can then pass them on to people in the community. That was through a previous Climate Challenge Fund that we made that partnership, and we've kept that on. Self-isolation shielding, we're getting more of an increase now of people referring to us, and the people that we're coming across. We definitely are getting to know our tenants better, because we have come across tenants that we just did not appreciate the circumstances that they were living in. So in one sense, that's been positive, because we're then able to provide not just food but other support. But now we're getting more with those who are shielding for 12 weeks, and we're getting those also through health professionals, through Glasgow City Council, through cancer services, etc., that we're able to pick that up. We're seeing also a loss of employment, increase in universal credit, and we're also working with our partners GMAP and others to can identify that and work with people. Increase in fuel poverty issues. People are at home more, they're using more energy. A lot of people are on the wrong tariffs, so we're kind of working around that as well. We just this week, we have employed an officer through our investment team. She was previously an energy officer with us. Because of when she was employed, she's not, she's working with us, so we're going to get her really involved in the energy. And I have to say that our elected members have been absolutely brilliant in terms of pulling a lot of that stuff together, so we'll link her into those. Seeing an increased report on health and mental health issues, that comes across through our conversations, and we do have a link of partners that we can speak to people with their permission and pass that information on. Again, it's just to have that support. We also did, in one of our MPs just the other day was saying, that she had been delivering a food parcel to one of our tenants as part of our response, and the person, had previous issues with addiction, alcohol addiction, and hadn't been able to maintain contact. So that will be one of the individuals that we will pass on a laptop, make sure that the broadband there and everything is there. So these are the things that you're kind of picking up, but some of the impacts that we're seeing. So our community response, as we could see that this was really starting, to make its way into the UK, we hold a monthly community networking breakfasts in Saracen House, and we usually get about 60 to 70 people in there. At the one that we had planned for February, we had to cancel that due to the guidance that was coming out, but we did manage to invite a number of people to say, look, let's just come and have a discussion. So we were spaced out and had a really good meeting around what some of the issues were, etc. So that was with community members, partners, and others fed into that, later on. And I, prepared a paper highlighting the areas of concern, some of the actions that people would suggest we took, the strategic and community approach, how we would all kind of come together and what we could do with the skills, with the resources, with the experience we all have, how we would communicate with tenants, identify the vulnerable, identify support services, and also how we could also support the local economy, given the fact, this is, major, for people who are kind of there. Also, establish community food hubs, so for food parcels and hot meals, and we also we previously had staff through a food and furniture initiative, which we had lost funding for, but we gave the 2 members a very short contract in the meantime while we looked to attract funding to maintain that. So we had 2 individuals, 2 vehicles that could really kind of work on the ground and support that. So and also support volunteers, etc. We also, one of the ideas was to work with restaurants, and we had a good partnership with a hotel group. So to work with them to see what they had just now that they could divert into the community, and we did manage to get a lot through that. We looked at virtual activities to establish those, activity packs for children, older people, and the daily contact, as I say, with individuals, mainly through telephone calls. So that was that's been part of our response. Partnerships. So partnerships are absolutely key to this, and what we did is we've had a number of Zoom meetings with elected members involved, with key partners, delivery partners, and others that could really support that. So there's been numerous calls, various areas, and then others with other housing associations that we're working with, because we are also you know, kind of cover an area with Maryhill, Queen's Cross, etc. And some others. So, and also the one thing I did want to mention was a business improvement district, because we were very much aware as well that local traders were going to be struggling through this period as well. I know a lot of restaurants had closed, cafes closed, etc. But there was also a number of chefs there that we could utilise within the community, and we've certainly done that, working together with Partick Thistle Charitable Trust. So they've got a bank of chefs there, and also with Possibilities, who's a community organisation in Postle Park. But the Postle Park Business Improvement District, because we found ourselves in another situation where suddenly we had to look at food supplies, and what we were finding is that volunteers were going and they're maybe buying food for the community, but people are thinking they're stockpiling. So there's a wee bit of, you know, as you get into the main large supermarkets. We do have a partnership with FareShare, but that's limited. So we started looking at, you know, well, what else can we do? And so we spoke to local traders who are in the steering group of the Business Improvement District, and we are working with them for regular food supplies. So, for example, the local butcher, the local grocery, the grocery post office is also run by Omar Afzal, who also works along the community engagement side of the Muslim Council for Scotland, and he was able to provide us with suppliers for halal food, etc. Right, you know, start of Ramadan. So obviously that was very, very important, and we've been working with those. Again, the local optician, he said, my input will be, if anyone has their glasses broken, they need those, I will repair them free of charge. They can drop them off. So it's about people kind of coming together through all of this. And also one of our large manufacturers, Allied Vehicles, has also provided a financial donation that we can support people just for things that could maybe come up, and it could be top up fuel cards, it could be, you know, anything, but just so that we've got something there. The Manaview Hotel and Leisure Group, you know, provided us, you know, already they were kind of a big refurb of the hotel, so we already got a number of beds, bedding, so we're also able to continue furniture distribution. The Clutha Trust provided us with a very large freezer that we were able to put into one of the community hubs for that. And during the 5 weeks, one of the main areas I was working on was to look at funding through available through Scottish Government National Lottery, and we're pleased to say that just late last week we had the National Lottery confirmed, which allows us now to develop this programme, to continue this programme for a period of 1 year. So we had said, you know, this isn't going to be short term. You know, once the lockdown finishes, whatever that is, we're still going to be left, you know, having to deal with issues, you know, around poverty, financial, you know, all the rest of it. So, so we're pleased that we've got that, and I have to say that that is a very much a partnership approach. So we will be the organisation who will then provided food to various organisations. We've got about 6 we're working with just now, and that could develop further. But that will go straight to source and to those who need, as well as additional resources that we can bring as an organisation. So this is just some of the I always like to put a few wee pictures in. It takes it away a wee bit, but this is just some of the traders and Jackie Shearer, who's a consultant working with the traders. Now, obviously, some of our areas that we're working on has to be put in the back burner a wee bit. For example, the Business Improvement District, we were looking to have a ballot around October. That is now not going to happen. We will be into next year. However, it will give us the time to work with traders, with others in a different means. So we'll be doing certainly a lot of work in the background. One of the things that I'm exploring just now is a local currency that people can use. So rather than have to go on buses, go to the large supermarkets, can we work in such a way that we can also provide some kind of card that they can use in their local shops, and how that would work. So that's something that we're kind of looking at just now, as well as the food parcels and the hot meal deliveries that we're delivering every day to vulnerable people. This is just an example of a community hub. You can see, I'm sure that will be 2 metres apart, but that's one of the areas that we're working on. So they're doing a fantastic job 5 days a week, around that area there. I just thought I'd just put this in, and sorry, just the way I've kind of photographed it, but someone passed this on to us, and we're now putting these out with food parcels. And I don't know if you can, so you can maybe kind of see it there, but we've photocopied those. And I did particularly like that, you won't be able to see it properly, but the slides too, and I can send this on to people, is saying, you're living through history right now, and we are, and it's just saying, take a moment to fill the pages for your future self to look back on. And here are some of the ideas that you could include. And I've looked to adapt that for older people. So, because some of the ones for children is, tell us about yourself and what age are you and what you do and what kind of things you like to do. So, another one is kind of how I'm feeling. So, which I think is appropriate to everyone. Words to describe how you feel. Draw how you feel. What you're thankful for. What have you learned most from the experience? What 3 things am I excited to do when this is over? And I think a lot of that, Marguerite, will be get out to play and get out and just getting, getting it into the great outdoors. Something I love myself, just to walk. Now, I did put down, this was a pre-COVID photo because people are very much together. But this just gives you an idea of, this is part of our food and furniture distribution centre, which is in the centre of Springburn. We do have our food supplies, we have furniture, etc., that we give to people free of charge, and obviously it's to help people settle in, stay within their homes, and it's and we also collect that from the community. So it's a kind of circular economy approach there. So that people want to be able to, and I think that's one thing that'll come out of this, that people just want to do something, they want to help out, and I think that will continue, because the kindliness and community that I've seen here, it already has been evident, but I have to say I've seen it a lot more within the past number of weeks. Recycled cycles. So we have been working for some time on a cycle programme to get people out into the great outdoors. We've been doing a lot of kind of physical activity programmes across age groups. But one of the things, again, we looked at, and we had some funding for Scottish Housing for Cycling Fund. It's not exactly the name of it, but we got some funding there. We have been gathering bikes that have been in disrepair, and we have a partnership with Scottish Prison Service, Berlin. And we have taken the bikes over there, and the inmates have repaired those bikes. They are now sitting with one of our other partners, who will then give them the final, health and safety check to get them certified to go into use in the community, and they will be they'll be distributed to key workers, including volunteers in the community. We have been asked to submit a funding application for £2,000 from Cycling UK, and that will be to purchase safety helmets, lights, you know, lockable devices, etc., whatever people need to get those bikes on the road. So we're going to be starting distributing those from this week, and we'll put that call around partners for that. So just a new normal, just some areas, and I know a lot of it's already been covered here, but what we're looking at is we're already discussing with our executive team, with others, what our new physical working environment is going to look like. You know, looking at the whole thing around health and safety, social distancing, you know, you're seeing it already in supermarkets, what we're going to be doing there. Flexibility in how we operate core housing services, we've already had to do that over this period. We've had a major investment going on in our multi-storey flats that's had to be put on hold. And we've got a new build that's had to be put on hold. So we're dealing with emergency, urgent services at the minute, but also the whole thing as well around financial support for people. Community activities, again, how we're going to operate those, because our community activities are vast. You know, I mean, our older people are very much missing our monthly song shimmy, which they so enjoyed, where they could go up and they could dance and they could just, you know, have fun. And that's a big, big loss to them. That's just one of those. You know, our Tai Chi, which was always full, things like that. You know, there are family breakfast clubs, all of that. So people are missing those things. How are we going to look at that as we move forward? Digital inclusion, I think that's going to be key area in terms of what we are doing later on, because, and we have been looking at already in part of our investment programme, is looking at things like hyper optics and stuff like that within our multi-stories and within our, and we've also been talking previously to health professionals around the use of technology, particularly with older people, vulnerable people, and how that can, and, you know, I think over this time we've seen that where people are maybe having you know, consultations, you know, virtual consultations. So that is something I see that is going to be absolutely key to moving forward. We see that there's going to be ongoing support for food, energy as poverty levels rise. You know, that it's not going to stop anytime soon. And how we then can help people to get back into that employment route or into, you know, further education, higher education to help support them maybe in a different, you know, area of work. Dealing with grief, isolation, mental health issues, we're already seeing some of that in the community just now. Sadly, you know, that, you know, we've already seen people who have, you know, lost their lives to this, and the families, we're working with the families with that. So that's going to continue, and I think there may be other ways that we can see that we're working appropriately around that, and maybe getting the appropriate training as well that we need maybe to support that. So, and also to maintain and build on the social connections and partners, I think that's really absolutely key. Somebody else said, and I'm sure we all agree, that no one can do this alone. And if a time is needed for people really to come together, it is now. So that's very much where our stance is, and working with others. And I think the other thing that we need to be able just to be able to do is just the ability to mobilise in line with the exit strategy. We don't really know what's coming, but if we have all the connections, we need to be able to react quickly, because I think that people then will have more confidence if we're able to do that. So that's kind of where we are just now. And yeah, I think that's me. So thank you.
Margaret, always great to hear you. I'm just taking somebody else off my screen here. Thank you very much. Some fascinating things. I love the idea of the time capsule. I think it's really, really important thing to think about. It's a really important thing to for people to actually be conscious of this time. I think this is a unique time. I mean, I try and reflect that in our own family, just having that kind of conversation. But I think that, you know, I think it's really important. So I value that. I think I might feel that one and use it in some of my own conversations. I'm awaiting some feedback from Andy if there's going to be some questions from our other people that have signed in today. I'm not seeing if there's anything coming through just now. I do have some of my own sort of questions and reflections I would, if I may sort of share with everyone. I don't have a picture here. Let's see if that helps. If it helps, yeah. So, yeah, working my way back here, I mean, I mentioned at the very top of this, there was a whole kind of conversation around place principle and our approach, a joined up approach of this. And I think, something that Peter mentioned, this idea of a sort of top-down approach of what good practice is, but also from the grassroots, listening to people, finding out what they really want, was really, really important. And what Margaret was saying there was that's been reflected in the way people are behaving locally. I mean, it's interesting. There was an article by George Monbiot, a Guardian article, and he was saying, all the predictions in horror movies about these kind of contagion type things were always, it was always the zombie type approach, and everybody attacking everybody and really dystopian futures. What's actually happened by that is some of the best behaviours we've seen in my recent memory have started to take place. People working innovatively, collaboratively, and in a caring way. So it has, generally speaking, brought the best out in people. Particularly around the aspect of play, I'd be interested to hear from Marguerite and others around this idea of, I mean, it was interesting that enshrining the right of access to play, but also the right to play and the right to hang about. I mean, I suppose the only sort of kind of comments that have been negative comments in my own community have been about, youths basically in the evening and not having much to do, and these are people who are not necessarily going to be wanting to sit in the house, but they're also wanting to meet their friends. How do we learn from what people need, and how can we deal with that in the immediate circumstances, but also moving forward is maybe something to think about. Margaret, perhaps, and negative comments in my own community have been about, youths basically in the evening and not having much to do, and these are people who are not necessarily going to be wanting to sit in the house, but they're also wanting to meet their friends. How do we learn from what people need, and how can we deal with that in the immediate circumstances, but also moving forward is maybe something to think about. Margaret, perhaps, and
Marguerite.
Was it me?
Margaret,
Yes. So,
yes.
I think it's very important. I know that when we were at the Community Planning Partnership in Dumfries and Galloway, they were telling us that the majority of calls, this was before the COVID-19 situation, the majority of calls they received to the 999 service was to complain about young people hanging about. And the follow-up question is, what are they doing? And again, 99.9% of the time, the follow-up answer was nothing. So we seem to have this intolerance to young people being out and about in the public realm. And so that is a real re-education process that we need to go through in society. This intolerance, even to like the noise coming in some areas from school playgrounds. But just now it's really difficult because what we really have to stick with is the physical distancing rules. But the young people, and particularly teenagers, are feeling extremely anxious and want to be with their mates and friends and seem to have the innate impetus to get out. And we see that with a lot of them trying to get out and hang about together. And we're not recognizing how important that is, and we're not even trying to facilitate it. So I think in the same way that we facilitate dogs getting out for a walk every day, I don't understand why we cannot give more priority to facilitating young people getting out and about, observing physical distancing, but having space to go and being given permission to go there. So I think it's something we really need to get our heads around, because obviously we might have a lift in restrictions now with a second wave or a third wave. And this is the opportunity to now actually see what it is can we do. Can we open up spaces, indoor, outdoor, for young people to come together with appropriate physical distancing? And I don't think it's beyond any of us to actually work out how to do that.
Very interesting. I mean, one of the things I was also going to touch upon is, I mean, you talked about space, especially in urban areas, and Russell, you talked about, the car being, well, I'll paraphrase you, the sewage of the 21st century. But I mean, I've talked to equivalent sort of colleagues in London, and the feedback they're getting is that, in some surveys that are happening there, people are very, very keen to get back into cars again, despite having enjoyed some of the freedoms of more space just now. And some of the kind of positive things that Petra was talking about, that the taking over streets again for play space, etc. What do you think the realities are in terms of that redefinition, that reassessment of our urban spaces in terms of streets, etc., if there is a change in terms of use of cars? Some people are saying we're leaping 5 years forward into a lower car dependency. Could you maybe look at two futures there, one with less cars, maybe one where we're trying to kind of still have this struggle? What first, Russell, what do you think about that?
It's all speculation, isn't it? I mean, ideally, what would happen was we could create places where people would be able to walk and cycle and get around that way, and have access to all of the resources that they need within that ability. But the fact is a lot of people commute long distances, and currently, or in the past, people that were using public transport I mean, I've heard anecdotally from several people that there's real concern about how they would get back on trains or use the bus again, and how that would be made safe, and how we could still maintain the social distancing and do that. And especially for people that have to take 2 or more buses or 2 or more trains, etc., and then interact with other people within the stations. So the chances are that there's going to be more cars on the road in the near future, because people are just going to be afraid of getting back on public transport. And so it's going to be something that we're going to have to face and see what we can do about it.
Yeah, I mean, interesting around that is that, I've heard some of that kind of noise coming through as well, and I suppose the other noise I'm hearing, which kind of complements that and maybe helps it, is this idea that whilst we're doing this type of thing, the virtual meetings, as an alternative to physically engaging, actually this may be one of the parts of the new normal. It is retained a little bit, particularly around commuting. I mean, I know myself, I normally commute in Glasgow. I'm a regular traveller over to Edinburgh as well, and a lot of that time, it is very useful, very helpful. But there's a lot of time and in that perhaps we need to maybe reconsider. So, Petra, anything you'd like to add around that in terms of?
Yeah, I think what Russell just said is definitely, there's a fear of that, but at the same time, we're only reaping the kind of infrastructure that we have allowed to be dominant, which is about all around the car. Whereas now we actually can repurpose how are we doing things. We're certainly thinking about, should we offer home working as an alternative? Now, it doesn't suit everybody, and some people like a structure, but I think it should become one of the offerings. We're wasting a huge amount of time, whether we're traveling to and fro. And I think this way, the virtual online reality is going to be really, really interesting. The reality, however, once we're out of this, is also, we are facing a climate emergency. That hasn't gone away. We're all now currently enjoying this wonderful, better and cleaner air, the clarity of vision now. That is so beautiful. And I think it gives us a glimpse of how polluted most of our cities actually are. And so hopefully out of that, we can take some real lessons for better infrastructure, better connectivity. And I know, for example, my mother in Germany, their lockdown has eased today, but they have all been assigned face masks that they have to wear in order to go on public transport or into shops. So we are still in this kind of reaction to the virus, but we need to think longer term now as well. We have reaped the benefit of challenging infrastructure. We've got to change in the future.
I mean, that's very interesting. I mean, there's an interesting balance between, I suppose, fear and confidence that people are having in public space and the use of public spaces. I think that you know, that they're in a new world. I think some of the confidence I was suggesting people are having once things are freed up might start to kind of retreat again a little bit. So I think there's some very interesting dynamics playing out there. In terms of people moving about and accessing any of the spaces, Margaret, up at North Glasgow, I mean, you talked a lot about, you know, really interesting supply chains and actually reaching out and you finding out new things about your community. I think that's happening in my own sort of community. Can you tell us a wee bit more about how people are actually, you know, the physical exercise people are taking and the movements people are making in your urban area, because it's potentially populated area.
Yeah, I mean, I think, to be honest with you, I think it is limited, you know, because the majority live in either like kind of high-rise flats or tenement properties. And you know, for a period of so some have maybe got their gardens can do, but there are some good examples as well. Because we've got an allotment space down at Springburn, so there's allotments there. There's also some just over in Milton, and just this week I was sent on some fantastic pictures from a family who spent quite a wee bit of their time down there. And they've been growing the vegetables, having their lunches and all of that there. Now, previously, we've been trying to encourage people to take more of the allotment spaces up and to share allotment spaces. I think this will support that a bit more. We've also been working around, it's a park over in Springburn, it's called Eastfield Park. It's been unused for a lot of time, and we've already been in discussions with other organisations and the council to bring that back. We've carried out a number of community consultations. We have spoken about things, you know, like again maybe allotment spaces, also like buggy runs and things like that. It's got fantastic big space that you could run around, and possibly things like outdoor gym. I think we maybe need to go. Maybe going to have to look at that again a wee bit more, and also kind of build on some of the other stuff that's happened. So around in Springburn Park, I mentioned, you know, that one of our groups through the participatory budgeting developed it's called MySpace, and it's fantastic space outside where people could just kind of sit and chill and you know, play games, just whatever they kind of want to do artwork, different things. Obviously, you know, looking at the numbers and all that, but could we have more of those spaces? We carried out, we supported a community consultation for Springburn using the place standards, and they've Springburn Regeneration Forum. So there's a lot of evidence in there about what people want. We're working in Postle Park just now with the Business Improvement District. We've already spoken about environmental, planters, things like that, just to kind of break up. But there's also quite wide streets in there. So could we utilise some of those spaces as well? You know, in a better way, linking into the kind of back garden idea behind the Postle Park Health Centre. So I think it gives us more opportunities and maybe more to think about. And I think as we start to relax the restrictions, how can we then introduce other areas, particularly thinking of the younger people and the older younger people. So for example, the canals, it's a great space. You know, could you have a system there? It's also, you've got great cycle tracks that are not very far away, down at Lamb Hill Stables, up there that can, you know, they go far and wide. So more use of allotments and reconfiguring the parks to be, you know, spaces where you could divide up, but also have spaces for people to explore and you know, make them more interesting, as well as some of maybe the smaller spaces that can still be used. So I think we just have to kind of, and I did like when Marguerite was talking about, you know, that there isn't space standards for children, you know, and the whole thing, you know, around that. That I think that's something we really need. It's kind of hit home with me a wee bit, and I think we need to look at that. So, yeah, I think we just need to. As we're developing work with partners, we need to take all of that kind of into account. And I would like to include the NG Youth Board. They're still in the developmental stage, but I think that's something that they could really, you know, take to task.
Margaret, you were wanting to come in.
I see there's a question from some people. I noticed one in particular from Emily Jennings, and she's talking about how we can create more play opportunities during physical distancing in the public space. I think one of the things I'd like to say there in particular at the moment is we know in Scotland, I think it's 29% of families live in flats. So that's a third of people who don't have a garden. And I think priority should be given immediately to people who don't have gardens, and to be able to set up opportunities near them where we can manage that. And I think, I mean, I know there could be volunteers or maybe local authority employees that are being redeployed, but we should be able to manage the access to this open space and prioritise these people in the very first instance. And I think there must be nothing worse at this stage than being cooped up in a flat with a family. Yeah. Work from home. So, and I think we need to get moving. I don't think we can wait till it's over and say, oh, we should have done it better. I think there's so many intelligent people out there, and I know we've got a fantastic number on this morning. I don't have the answers to everything, but I'd really welcome suggestions, and we will try and do it as part of the national lobbying. I know Peter would do the same. So I think it's really important that people, if you've got good ideas out there about how we could do this, let us know, and we'll try and put those forward.
Okay. Thank you. There are a couple of, as you say, a couple of questions have come through, and I'm going to just go through them all. I think that there's maybe half a dozen here. So there's one around, you know, how would all of this stuff we're talking about relate to development management? We've touched upon that. How, you know, planners can make decisions to make better places. There's also a question in and around free range options. So in terms of that one, Peter, would you like to come in first of all? You have to see you put your finger up. Do you want? We'll cover that one first then, if you want.
In terms of planning system, I think we need to understand the separation between the public, the planning professionals, and also the elected members. So they have to work together. So the public must inform the elected members what they would like to see. There has to be a dialogue, much more, I would say, much more creative than in the past, where there was a plan, then it was adopted, and that's it. You know, we need to think differently about our places, and we need so much to get all of our people involved in the discussion around place. It doesn't matter if you come with a housing association, and I really welcome the idea of the youth board. We're thinking similar in Link Group as well. It's fantastic, because the voices of young people are so not listened to, and they need to be listened to because they're the longest with the decision that we are making today. And at the same time, they are the ones that are the beneficiary of a much policies around climate change and so on. So I really welcome that. But I do think we need to ensure that we're no longer just, as I said before, segment, here the elected member, here's the planner, here's the designer, here's the architect, and over there's the public. We all have to work together in this.
It's interesting as well, there's another question coming in from Bill Lindsay around new planning performance indicators take account of well-being and satisfaction with place. So, you know, I think you're touching upon that, Peter, but I think, but how would we, if so, how would we measure that satisfaction?
Yeah, I had two really interesting thoughts on that. For us, it is very difficult because the system to compare with other European countries is always very difficult because we have a different kind of political system. So if you take Paris, where you have a strong mayoral kind of approach, she has adopted a diktat where every public space within 15 minutes, and public space meaning also cafes, green spaces, has to be within 15 minutes walking, not driving, which is a fantastic approach, and that will be implemented. At the same time, in Berlin, for example, you had the mayor there saying, because of the hike in private rent, he put a diktat on there and say no more than so and so many euros per 100 square meters. And I find that really quite interesting. It can be done, but we have a different system here, which is sometimes challenging, I would say.
I can say that the place efficiency duty, when we do the place efficiency assessments, at the absolute heart of those will be satisfaction from the community about, or particularly from children, about what's on offer. And I think that is at the core. I mean, I think that will be how we start to answer that question, because the minute children's satisfaction levels are taken into account, you can be absolutely certain that adults will want their satisfaction level taken into account as well.
That would be really good.
But the point is that Gail Penalosa tries to make is, if we get it right, if children of 8 are satisfied with the offer, then we'll probably find that the whole population will be satisfied with the offer. So I would say the priority has to be on the younger children to try and see if they're happy. But also, I think we need to think long and hard, as Peter was saying, about teenagers and how are teenagers accommodated throughout Europe quite happily. And yet we seem to have demonized them, completely forgetting that we're teenagers ourselves once upon a time.
Wow.
And the minute we create a really nice space that they can bring along their skateboard, even if it's not intended for that purpose, we say you can't do it. So why can't we open up school grounds and playgrounds and parks to these young ones and say, get out there on your skateboards and have some fun? Although I have to say, I think this message about staying indoors seemed to have prompted a lot of them to want to go outdoors more than they've ever wanted to go out. So maybe we should reverse the messaging a wee bit.
Can I just add one other point, Danny, if you don't mind? And that is the multi-generational discussion we have to have, because we have an active aging population. We've got to make sure that we also cater for an active aging population. Today, 64-year-olds have the chances to live into the 90s, and they're not all going to be living in care homes. Many of them are now physically, I mean, I think just the other day, a 75-year-old passed grade 1 in Bali. You know, these are the kind of things that that's the new reality. So our places have to be adopted definitely for young people, but also for multi-generational purposes as well.
I think the intergenerational thing is very interesting. I was reflecting on listening to you all on work that I was involved in years ago in East Renfrewshire Council. So there's a project called Barhead Going Places. And the initial look at that was getting people to use gold disposable cameras. So this was actually, it was early days digital cameras, and going out in their community and looking at everything from their own garden, if they had something, through to their school grounds, to the paths, to the parks. And we got, and then it was take some pictures, they were uploaded, and then pass the camera on. Now, we couldn't do that these days, but the interesting thing was then you start to get a picture about what people are interested in and concerned in at different scales of green space across different generations. And interestingly, despite the fact that different groups had certain, I suppose, assumptions about what other people were liked or didn't like, their needs and wants and concerns were actually all very similar across the generations. So we're not that different. And I think in some ways, some of what's happened just now has brought generations together. I think people are more aware of people on the fringes of society and more vulnerable old people, perhaps. And there are people, there's neighbourliness going on that perhaps should have been, but hasn't been going on in the past. So I think there's something, this idea of when people take the time to look at what they've got in terms of their physical resources, their spaces, and how they're connected, and voice why they may be not going into other places, then there's a very interesting conversation. I think this idea of a conversation, touching back on the main things we mentioned, and Peter mentioned a very positive look at the place standard. I think there's a very interesting opportunity to have real, honest, transparent conversations about the places we need, we want, we like, we're worried about, we're fearful of, and to kind of build new cultures around those. I'm just having a wee look around here, see if we missed any big topics in the questions here. I mean, the conversation around the free range children, Marguerite, and there's been a couple of comments and questions coming in here. I mean, how do we fit that aspiration into a culture which is potentially quite risk averse and probably anti-children in some respects in terms of public realm? Any thoughts on that, Marguerite?
Yeah, I mean, I think we're going to have a huge challenge on our hands now after this, because I think a lot of children are scared stiff of not washing their hands and going outside. And I've heard some colleagues talking about their children aged between 4 and 7 refusing to go outside. You know, they're just too scared. So they've really absorbed this message. So to suddenly think that these children could go out tomorrow if the restrictions were lifted and be free range children, it's not going to happen. And along with lots of anxious children, there will be lots of anxious parents that maybe weren't anxious parents before this. So I think we've got an absolute challenge on our hands. And I think it is about looking to use much more, have priority access of local streets, local spaces in and around where children and young people live. Because for a long time to come, it's going to be play overseen and supervised by the parents and overlooked by the parents. And if that has to be the street outside where you live, which is where most children actually want to play on a regular basis, then this idea of having play streets where children are play to free, not to be, you know, supervised by people in high vis gear, but just to be allowed to play freely in their streets. So the parents can pop their head out the window, or they can run back into the house and feel free. So we have to build up this confidence for playing in sight of the parents before we can start to build it up out of sight of the parents. So I think we need to, I mean, it's a game changer. Peter was saying that too, this idea of home streets that we should have had all along from the 80s and has never taken off. Car is king. And as a car driver, I put my hand up and say, I'm one of these people that drives cars all the time, but actually the children have to be king, the families have to be king, and they need to get priority over these streets while we get people back outside and socializing and playing together.